Usually when we talk about a medical diagnosis, there's this expectation of absolute precision.
Right, like a very clear, objective metric.
Exactly. If you break your arm, we can look at an X-ray, point to the jagged white line on the screen, and just say, there's the problem.
Yeah, it's entirely binary. It's either broken or it's not.
It's clean, and honestly, it's comforting. We like things to be visible. We like to categorize our pain. But what happens when the pain isn't a fractured bone, but something deep in the mind?
The picture gets incredibly murky.
Which is just a massive question. And it requires us to pull from completely different realms of science, from neurobiology and microbiology on one side to sociology and epidemiology on the other.
Right, and we're approaching this from two very distinct perspectives based on the source material. I'll be arguing that depression is, at its core, an internal physiological and cognitive dysfunction. It's rooted in neurobiology, the microbiome, and our attributional schemas, and it requires targeted internal interventions. And my position is that depression is fundamentally a psychosocial condition, where those biological and cognitive changes are actually secondary manifestations of environmental trauma, alienation, and social stress.
Okay, so let's jump right into the frameworks. If you've looked into depression, you know that the physical exhaustion and the mental fog are just incredibly real.
Absolutely paralyzing for people.
Exactly, and I argue that to truly understand why that happens, we have to look inward at the literal machinery of the human body. When we scan the brains of severely depressed individuals, we aren't just seeing some abstract, poetic sadness.
No, you're seeing physical changes.
Right. We are observing measurable physical deterioration. We see smaller frontal lobes. We see physically reduced volumes in the hippocampus, which is the area responsible for memory and emotional regulation. We see a profound depletion of crucial neurotransmitters like, serotonin, norepinephrine, and dopamine.
And I want to be clear, the biology is certainly altered. I mean, no one is debating the physical scans here.
But see, it goes so much deeper than just the brain. Some of the most groundbreaking research right now focuses on the gut microbiome as our second brain.
Oh, the gut-brain axis is fascinating.
It's staggering. We have this massive neural superhighway called the vagus nerve. And for a long time, we thought the brain was the CEO, right? Sending orders down to the organs. But 90% of the communication along the vagus nerve travels from the gut up to the brain, not the other way around.
Wow, 90%? That's a huge feedback loop.
Right, and here's why that matters for depression. Our gut flora, the trillions of bacteria living in our digestive tract, produces the vast majority of the body's serotonin and GABA. Now, GABA is basically the brain's brake pedal.
It calms things down.
Exactly. It's responsible for tranquility, for stopping the mind from just spinning out of control into panic. And serotonin gives us that sense of baseline satisfaction. When the internal ecosystem of the gut fails, the brain is quite literally starved of those chemicals.
Okay, I see where you're going.
So if a patient's gut flora is eradicated by, say, a massive round of broad-spectrum antibiotics, leaving harmful bacteria to thrive, depression is the direct mechanical result. It's a pathology of the organism itself.
Look, I hear your focus on the machinery, and the gut-brain axis is remarkable. But focusing strictly on the internal mechanics entirely misses the forest for the trees.
How so?
Well, I come at it from a different angle. If we look at the sociological reviews in the material, the data systematically dismantles the idea that depression operates in some sort of biological vacuum. Take the cognitive aspect you mentioned earlier, the internal frameworks, or what psychologists call the attributional model of depression.
Right, learned helplessness, the idea that a person's internal cognitive style, basically how they explain their own failures to themselves, drives their despair.
Yeah.
Like, if I fail a test, do I tell myself it's because I didn't study enough? Or do I tell myself I'm fundamentally stupid and there's no point in trying?
Exactly. And for decades, the attributional models suggested that if you just fix that internal narrative, you fix the depression. But modern epidemiological reviews reveal something utterly fascinating.
Which is?
Those internal cognitive models completely lose their statistical significance when broader social variables are accounted for.
Wait, clarify that for me. Are you saying
The negative internal thoughts just don't matter?
I'm saying they are present, but they are not the driver. What the data shows is that poverty, family dysfunction, lack of social support, and specific environmental traumas are the true engines of this illness.
Okay, but
I may give you an example from the epidemiology. Studies track the impact of childhood trauma into adulthood, right? Women who suffer childhood physical abuse show a 40.3% prevalence of major depression later in life.
that's incredibly high.
It is a 7-fold increase compared to the general baseline. So when you ask why someone believes they are helpless or why their biology is failing, the answer isn't a spontaneous internal glitch. Depression is an adaptive or perhaps maladaptive response to severe external alienation, stressful life events, and socioeconomic deprivation. The environment dictates the internal state.
I see why you think that, but let me give you a different perspective on the direction of causality here, because I certainly acknowledge the profound role of stress and trauma. But biological mechanisms can and do fail entirely independent of external circumstances.
Independent of the environment?
Yes. Let me offer an analogy to help visualize this gut-brain connection. Think of the human nervous system like an apple tree. The environment, the amount of sun, the rain, the surrounding weather, that's the psychosocial context.
Okay, tracking.
The gut microbiome is the root system underneath the soil. Now, even in perfect weather, in a perfectly supportive social environment, if a fungus attacks the roots, the leaves of that tree will wither and die.
So you're talking about a biologically isolated incident.
Yes. Let's say a patient gets a severe infection and takes a massive dose of broad-spectrum antibiotics. That acts like a nuclear bomb in the gut. It wipes out the aerobic, good bacteria that manufacture those anti-inflammatory, antidepressant compounds we just talked about.
Right, the GABA and serotonin factories.
Exactly. And in the vacuum left behind, putrefying bacteria take over. And here's the really important how. Those bad bacteria produce actual toxins and inflammatory markers that travel straight up that vagus nerve to the brain, causing severe neuroinflammation.
The biology is powerful, yes.
So my question to you is, how do you account for severe depression that arises purely from an internal flora imbalance in someone who has a loving family, a great job, and zero external social trauma? In those cases, the biology breaks first.
That is a compelling argument, and I like your tree analogy, honestly. But you are ignoring the soil in that metaphor.
The soil?
Yes. I agree that purely biological triggers exist, like an infection or a thyroid deregulation or an antibiotic wipeout. But if you plant that tree in toxic, irradiated soil, which is what extreme poverty, systemic racism, or childhood abuse functionally is, it doesn't matter how robust the roots are. And it doesn't matter how many probiotic fertilizers you pump into them. The tree is going to suffer.
But a healthy root system can withstand a lot of bad weather.
Bad weather, yes. But we are talking about a polluted ecosystem here. The origin of depression for the vast majority of people is environmental. You asked how the biology breaks. The data shows that severe life stressors literally dismantle the biology.
Through stress hormones.
Right. Take the neuroinflammation and hormonal dysregulation you just mentioned. Prolonged exposure to severe stress fundamentally alters the HPA axis.
Okay, let's pause on the HPA axis for a second, because that term gets thrown around a lot. Just break that down for us. What does the HPA axis actually do in a human body on say, a normal Tuesday?
Sure. The HPA axis, the hypothalamic pituitary adrenal axis, is essentially your body's central alarm system. On a normal Tuesday, if a car swerves into your lane, your brain's hypothalamus perceives the threat and sends a signal to your pituitary gland, which then yells at your adrenal glands to flood your body with cortisol and adrenaline.
The fight or flight response.
Exactly. Your heart rate spikes, you swerve out of the way, you survive. The threat passes, and the alarm turns off.
Because it's an evolutionary survival mechanism.
Right. The human brain evolved to handle acute, temporary threats. A tiger chases you, you escape, the stress ends. But what happens when the tiger never stops chasing you?
I see where you're going.
take a startling epidemiological statistic from the material. Right now, there is a 33.8% unemployment rate among youth actively studying in Bogota. Think about the psychological weight of that.
That's crushing.
You are studying, trying to build a future, and you know statistically you are likely to be entirely locked out of the economy. That isn't a bad day. That is a tiger that is always in the room.
It's chronic, inescapable stress.
Exactly. And when that alarm system is forced to stay on for months or years because of inescapable poverty or living in a home with domestic violence, the alarm physically breaks. The chronic flood of cortisol literally causes those morphological alterations in the hippocampus you mentioned earlier.
Shrinking the brain's memory center.
It physically shrinks it. You cited the 40.3% prevalence of depression in abuse survivors. That isn't a random gut bacteria imbalance. That is the outside world inflicting violence on the human body, which then manifests as biological depression. The environment is the primary pathogen.
Okay, so that actually brings us to a really fascinating friction point. Where exactly do we draw the boundaries of what true depression actually is? Because I think we need to be incredibly precise here.
Precision is good, but human experience is messy.
True, but we must separate clinical major depression from normal human sadness or environmental grief. And the psychiatric classifications from our material draw very distinct lines.
See, I think those lines are a lot blurrier in real human beings than the diagnostic manuals want to admit.
But the distinctions are functionally vital for survival. Let's define our terms. Major depression is characterized by anhedonia. Now, this isn't just feeling incredibly sad. Anhedonia is an absolute physiological inability to feel emotional reactivity.
A complete flattening.
Yes, the patient rationally knows an event is joyous, maybe they just had a child or got married, but they feel absolutely nothing. It is a severe blunting of the entire affective system. Then, separately, we have dysthymia.
Which is a more chronic melancholy.
Right, often tied to personality traits, where emotional reactivity is actually still present. And finally, we have adaptive disorders, which are direct, intense emotional reactions to real-world stressors. My point is, if you conflate a severe adaptive disorder, like grief over unemployment, with true major depression, you are totally obscuring the root biological problem of the latter.
I'm sorry, but I just don't buy that neat categorization. It assumes human emotion exists in these perfectly sealed Tupperware containers.
How so?
Let me tell you why that doesn't work. When you study the actual trajectories of patients, you see a profound conceptual difficulty in differentiating between stress, anxiety, and depression. They bleed into one another. You call an adaptive disorder a reaction to a real-world stressor, as if it's just a temporary hurdle to get over.
Well, no, it causes prolonged distress, absolutely. I'm not minimizing it.
But what happens when the real-world stressor is permanent? It morphs, it doesn't stay an adaptive disorder. The chronic stress of that 33.8% unemployment reality leads to chronic anxiety.
Okay.
That anxiety overworks the nervous system, which, over time, completely depletes the individual's biological coping resources until they collapse into an anhedonic depressive state. Trying to clinically slice the depression away from the poverty or the alienation is missing the actual mechanism of how the illness forms.
That is an interesting point, though I would frame it differently. I am not denying the reality of that socioeconomic suffering. But let me push back with a very practical question.
Go ahead.
If you are a practitioner and a patient sits in front of you with major depression, meaning they show severe neuroinflammation, disrupted circadian rhythms, and an absolute inability to feel joy, and you treat it as just an extreme reaction to the unemployment rate, don't you risk denying that patient the immediate biochemical interventions they literally need to survive today?
Well, nobody is suggesting we ignore the patient's immediate pain.
But if we say your depression is fundamentally caused by society, we are effectively telling a patient in a suicidal crisis to wait until we fix structural inequality to feel better.
That's not.
If you're struggling to even exist, hearing that your illness is just a symptom of late-stage capitalism might feel validating on a philosophical level, but it is incredibly unhelpful when you physically cannot get out of bed in the morning.
But no one is suggesting we withhold psychiatric care while we wait for some utopian social reform. I completely agree they need immediate help, but we have to be honest about what that biochemical care actually achieves.
It saves lives.
It does. But prescribing medication without addressing the social environment is at best a band-aid on a bullet wound. We know this from studying adolescent depression. Young people need social skills development, strong peer groups, physical safety, and stable family dynamics to actually recover. Do you know why the relapse rates for clinical depression are so incredibly high across the board?
Because the underlying biological vulnerabilities haven't been fully repaired yet?
No, it's because we biochemically stabilize a patient in a sterile clinical setting, and then we send them right back into the exact same toxic, abusive, or impoverished environment that broke their HPA axis in the first place. The environment reinfects them.
I have to challenge that entirely. That biochemical stabilization is not just a band-aid. It is the reconstruction of the biological foundation necessary for them to even engage with their environment.
Efficacy of direct internal interventions. We have cognitive behavioral therapy, which isn't just talking. It actively rewires the brain's neural pathways to break the physical loop of rumination.
It rewires how they react to the environment, yes.
In looking at the microbiome, the interventions are incredibly specific and entirely biological. We aren't just giving them pills to numb the pain. Treatment protocols now use high-dose probiotics.
Right.
We are talking upwards of 15 billion live organisms administered to actively outcompete those putrefying bacteria in the gut. We use targeted prebiotics, like green plantain flour.
Wait, green plantain flour is going to fix clinical depression?
Let me explain the how here, because it's just fascinating. Green plantain flour is a resistant starch. Unlike regular food, it doesn't digest in the stomach.
Okay.
It survives all the way down to the colon, where it acts as direct fuel for the specific good bacteria that manufacture a short-chain fatty acid called butyric acid. When butyric acid floods your system, it acts as a powerful systemic anti-inflammatory. It travels to the brain and physically turns off the neuroinflammatory fire alarms.
I understand the chemistry, and it's brilliant science. It really is.
So my challenge to your timeline is this: fixing society, securing employment, or rebuilding a fractured, abusive family dynamic takes years, if it happens at all. Repairing a patient's microbiome, feeding their gut-resistant starches to produce butyric acid, or rebalancing their neurotransmitters, doesn't that offer the only immediate lifeline to pull them out of the dark? If the internal machinery is broken, the patient has zero capacity to fight for a better environment.
It is a lifeline. I concede that entirely. I am not anti-psychiatry, and I am not anti-biology. But a lifeline only saves your life if someone eventually pulls you out of the freezing water.
That's a fair analogy.
If we give a teenager green plantain flour and CBT and 15 billion live probiotic organisms, but they still have to go home every single day to a father who physically abuses them, the biological intervention will ultimately fail.
The environment is a relentless headwind.
Exactly. The daily stress of the abuse will continually trigger the HPA axis. It will flood the body with cortisol. It will reignite the neuroinflammation, wipe out the gains made by the resistant fiber, and deplete the serotonin all over again.
It's a cyclical battle.
The biological treatments buy us time. They keep the patient breathing. But the systemic and behavioral treatments, getting them out of poverty, integrating them into a supportive peer group, establishing fundamental physical safety, that is the actual cure. You can't out-medicate a traumatic environment.
I think we have reached a really illuminating point of clarity in our disagreement here. As we look at the totality of this issue, I maintain that the physical and cognitive reality of depression simply cannot be sidelined or viewed as merely a symptom of a sick society.
It's certainly a primary factor for you.
Absolutely. The evidence of structural brain alterations, the absolute dominance of the gut-brain communication network, where the vast majority of traffic is ascending to dictate our moods, and the distinct psychiatric profiles like profound anhedonia, it all demands our immediate focus. We have to treat this condition as a severe internal pathology first and foremost, because until we repair that physical internal ecosystem, the patient remains trapped in their own mind.
And I would summarize my stance by saying that while I completely acknowledge the biological mechanisms, the vagus nerve, the gut flora, the neurotransmitters, they are simply the vehicle of the illness. The societal environment is undeniably the driver.
The environment drives the vehicle.
Precisely. The epidemiological data on abuse, unemployment, and systemic alienation is just too massive to ignore. The biology does not exist in a vacuum. It is constantly listening to and reacting to the outside world. Therefore, true, lasting resolution has to be psychosocial. We have to address the root environmental causes rather than just indefinitely managing the internal biological symptoms of a species that is fundamentally stressed out.
Well, what we undeniably agree on is that depression is a profoundly complex interplay. It is a constant dialogue between the mind, the body's internal microecosystems, and the macro environment we live in. The human being is an integrated system.
We do agree on that. We simply continue to disagree on which factor represents the true root cause, and consequently, where society must place its primary focus for intervention.
It is a phenomenal complexity. Examining depression through the microscopic lens of gut bacteria and brain chemistry, while simultaneously looking through the macroscopic lens of economic realities and family structures, gives us a much richer understanding of what it means to suffer and what it means to heal. We encourage our listeners to explore these concepts deeply in the material, trace these biological and sociological pathways for themselves, and really draw their own conclusions.
It really does change how you look at the human experience. Once you see the connections, you can't unsee them.
You really can't. Which brings us back to where we started. When you look at the X-ray of a broken arm, you see exactly what went wrong. But when you look at a human being struggling with depression, you aren't just looking at a broken bone. You are looking at a broken environment, a struggling biological ecosystem, and a heavy mind all at the exact same time. The diagnostic waters remain murky, but perhaps by fiercely examining both the biology and the society, we can finally begin to see through the mud.